And I would love to take this moment to introduce Regina Phillips, who is an adjunct professor in the UNE School of Social Work. She's going to be our moderator today, and we're very grateful to have you. Regina.
Good afternoon. Thank you so much for having us come and talk to you about culture today. Culture and health and awareness and bias and that and those kind of things. My name is Regina Phillips, and I wear a couple of hats. I am lucky to be able to work as an adjunct professor here at the University of New England, teaching a class called Empowering Cultural Education, and there's a couple of students here that are in that class. My full-time job, though, is working for the Westbrook School Department as the Grants and Community Engagement Coordinator, and I also have started a consulting business with one of the panelists, Dr. Delac. I'm sure she'll talk a little bit more about that. A consulting company on culture awareness and equity and bias called Cross Cultural Consulting Group. It's an LLC, and we do that on a part-time basis. And so I'm really excited to be here today to not only introduce you to friends of mine, but I'm also excited that you get to hear their stories. Their stories about how they arrived. Their stories about accessing services, accessing health care, their story about transition, and their family story, their history, and the struggles that they endured in making sure that their families were safe. And so some positives, some negatives. And so the panelists that we have here today, we have a couple of questions, but I really just want them to be able to tell their story. So the way this is going to go is I'm going to have each one of them introduce themselves, and feel free at any point in time to ask questions, because really when we do these things, this isn't about us talking to you. This is about having a conversation and a dialogue with folks to make you understand a little bit more about people's culture and what they've experienced. So really, if you have any questions, please feel free to speak up, because we want to make sure that your needs are met. After that, we probably have about an hour for that, maybe a little bit less. And after that, what I've put on your tables is a little vignette about a case that Decker and I worked on when we were working at the City of Portland Refugee Services many years ago. And I will explain that when the time comes. But it's just about a family that it is actually a true story, and it's about a family that resettled in Maine and some of the difficulties that they experienced trying to assimilate. So with further ado, is it further ado or no further ado? Further ado with what? Without further ado. Thank you. My people. Without further ado, thank you, I'm going to introduce the panelist. I mean, I'm not introducing them. They're going to introduce themselves. I think I need a script.
So my name is Decca. As I said, I have been in the United States for a little over 27 years. I have 3 children. My oldest is 26. I have a 19-year-old and 18-year-old. They were born in Atlanta, so I've been here a little bit time. Do you want us to answer all of these questions at the same time, Regina, or do you?
No, just an introduction.
Okay. I mean, introduction can be a long for me, so I don't know. What do you mean by that? Like I said, I don't follow directions well.
Sorry.
Give me a time.
What?
You're going to give me a time. How long do you?
Oh. Sorry.
So
You know what it is I'm worried about this because people on that side can't see. And so I want everybody to be able to see the panel. So I'm worried about that, and then I'm worried about you. So,
Okay.
So
Okay.
I apologize. I apologize for that. But I see Toho over there, and I can't see anybody.
Hey, Toho. So anyway, I'm going to give myself.
My name is Sana Osman. I'm a community health worker at a nonprofit organization here called Main Access Immigrant Network. I am originally from Sudan, and I speak Arabic. My first language is Arabic. I was born in the United States way back 1900s. and but I wasn't raised here, so we left. My parents were here because my dad was he came here to have his master's and PhD in California, and so we went back to Sudan. He said he had 2 girls. He said, I'm not raising girls in America. So we went back to Sudan. He worked for the United Nations, so we moved around a lot. But I came back about 1999, so about like 20 years now, with my husband, and I have 3 children who are all born here. Yeah, and that's about it. Thank you.
Hi, my name is Noelle, and my family is from South Sudan, but I came to Portland, Maine when I was in 2nd grade, so I consider myself a Mainer and a Portlander. But basically, yeah, I'm from South Sudan. Before we moved to Portland, we lived in a refugee camp in Ethiopia, and from there we moved to America, and we lived in Jacksonville, Florida for a little bit, but then moved to Maine, Portland in particular, because of family and because of just being able to be around people who can support you genuinely meant a lot to my parents.
That's right. So one of the questions is, first of all, to thank you for your introductions and letting people know where you're from. One of the first questions is just really on health disparities. So what do you see as the health disparities for folks in your community or the folks that you represent?
So I can start. For me, health education. So I'll only speak from my family or from my own experience. But for my mother, just having the education around different healthcare plans. So as immigrants, we came here, and the very option you have is obviously main care. But because as a family, we didn't have the education of like, I was a child then, but my mom has always been working, and I'm not sure if she's ever known that she has an option to get healthcare with her job, opposed to just depending on main care. Because after growing up here, I'm obviously seeing the difference between quality healthcare, and just with the issues that my mom is having now. So she has thyroid, and so being in the position that I am in, I just feel like if I had, if my family had more education around the different healthcare options, then my mom's sickness wouldn't have gotten to where it is now, because we actually moved here 2001, and by the way, I know nothing about health. My background is actually in just community organizing, and my position is actually, I'm just the coordinator for Portland Housing.
Not just.
Well, I'm a coordinator for Portland Housing Study Centers, and I work with adults, I work with young people, but it came to this panel because I obviously have an experience. And so honestly, just access to health education for my community and for my family is what is needed, because when it's too general, then it's too late. Yeah.
So as Regina said, I used to work for the City of Portland in different departments. I worked for the City of Portland Social Services and also Minority Health Program. And also I was for some time an interpreter and also a cultural broker. So I have seen many health disparities when it comes to the immigrant communities. For example, when I worked for the City of Portland as life skills aid, we were teaching folks how to turn stoves, how to be careful for using such chemicals because it's not good for the health of their children. But we also opened so many other ways of teaching them and educating immigrant communities and refugee communities about the healthcare system, which was really interesting as a life skills aid at the time. one of the things that I experienced was that families believe that if a woman is pregnant, she should not have a cesarean because of the fact that the doctor is making more money if he or she does that. And when we were trying to educate community members about, it's a risk for you to have the cesarean section, that's why your doctor is telling you to have, she will answer right away, I had 8 kids in the refugee camps, and I never had any of those problems. Why this doctor is not taking the time to let me have this baby naturally? So that was one of the things that we experienced. Also, another thing that we have was that when I worked for the what is the name is just escaping from my head, Minority Health Program for the Public Health Division of the City of Portland, women were not aware of STDs. Nobody knew what it was, and the way we approached for that education was to let them know that it's really a deadly disease, and that does not mean that you have it or you're going to have it, but your children are born here, and you can educate them about in the future for them if they're having a sexual partners or whatever, to let them know that this is very dangerous thing. So we just want you to be educated about it. So that was really interesting for the families and the women especially to not get that, and was thinking that we are assuming they're going to have it or they have it, things like that. But we also have stories that we were telling them about the fact that many of the men, the immigrant men who lived here, were going back to Africa or certain countries in Africa and getting married, down low, and not checking the women that were married to at the time in Africa who might have some STDs, right? And they will come back to the United States or Canada or other countries in the Western world and infect their wives. And the wives, will say, my goodness, I have only one sexual partner. How did I get this STD? So we come around that way for the education piece so that they can open their minds and say, you know what, this is really very difficult thing for me to have, so that I need to know about it. So another thing that I experienced doing interpreting was one of my clients. Let me back up a little bit. When you go to the hospital or your doctor's appointment to talk to your doctor, usually the doctor has this much time to see each and every patient, right? And in the immigrant community, we have, to talk about all our lives to our doctor and say what we're feeling, although we don't know exactly what we're feeling. But in this particular case that I want to tell you was a woman who, she was in her doctor's appointment for a checkup, normal checkup. She's very religious person, and the doctor is brand new to the hospital at the time. And, the doctor is looking at her computer, asking all kind of history questions that she had. And one of the questions was, how many partners do you have, sexual partners? Do you have women? Do you have sex with women, men, or both? So I kind of hesitated to, say that to the patient or the client, and the doctor kind of realized that I'm not saying what she said. And she looked at me like, what are you doing, lady? Talk. And when I said that, the woman was really, really angry, and she really dropped that F word on the doctor. But now I'm saying maybe that was towards me, not to the doctor, for even thinking about saying that. So we need to educate our doctors and really do understand. They need to do understand where these folks are coming from and what their background it is, what do they believe in. As Nawal said, education is the best key when it comes to doctors and patients to understand each other. And it is also very important for the doctors to be able to go around the community and the stores that we are shop, if you will. My mom She left about 5 years ago. She lived here with us for almost 20 years, but she never took any medication. She will eat some garlic. She will use some black oil seeds. She will use, remedies that are known to her for 50 years, 60 years. And Maine Med had a great education at their Congress and India Street Family Medicine. A great doctor, Dr. Rothenberg, what she did was whenever she's having a new doctor is coming to her practice, she will take them all around the community, for the Southern Sudanese community, what they buy, for the Somali community, what they buy, for the Vietnamese community, for the Cambodian community, so that they have some kind of understanding the patients that they're going to be serving, to understand what kind of foods they eat. So when you have a Somali patient come to you and you say, well, I know that you do eat anjera, but if you change that flour to white flour to whole wheat flour, you will have a great connection with that patient, because that patient is know now that you researched their foods and nutrition factors that they use. So education is always the key to be able to have, and we all know there is a lot of disparities when it comes to people of color, minorities, and our healthcare system.
From my experience working with immigrants and refugees in our organization, I think the problem is always with navigating the health system and insurance, especially having main care versus free care. When do I need to apply for Obamacare? Do I need that or not? And also the knowledge of insurance itself, because a lot of countries, I know in Sudan, insurance idea is just recently introduced to Sudan. So a lot of people, you have money, you go to the doctor, you don't, you have to find a place where you can get the money so you can go. And that is a real issue for them. It's new to have insurance and dealing with insurance and how to apply for it and where to get it, and if I qualify for this, do I qualify for this or not? And also the idea of in here, like clinics, healthcare providers, there's a nurse practitioner, there's a nurse, you can see, a nurse practitioner can give you a prescription. For us, you see a doctor. A nurse is, sorry to nurses, but you're second to a doctor. So I want to have my primary care to be a doctor. I don't want to have a nurse practitioner. So this is, a lot of people have this idea that she's not as qualified enough to be my doctor, so she can't treat me, so I need a doctor to see. And sometimes people hesitate to ask, like they feel like they're going to offend the provider if they say, I don't want a nurse practitioner. So they go with it, but they're not comfortable going to that nurse practitioner. And also, like having a primary care. In Sudan, you feel chest pain, there's a cardiologist sign, and you go to see something's wrong with my chest, something's wrong with my belly, I go to a gastroenterologist. So you don't have someone who knows all your history, who's a primary care, and you go back to every time, or he refers you to places. So that's the thing that's completely different for a lot of people. And also dealing with interpreters. Even though I am an interpreter too, I am a medical and court interpreter, and we are supposed to be, it's confidential whatever happens, and we tell people that, but it is a small community and they worry about it. They worry about that interpreter being with me in all these settings and knowing all this information about me. And we understand that because a lot of people, we deal with them socially too. It's not just we know them. So you end up being with somebody you might know. And that is kind of a struggle, and I feel that people sometimes feel like if they said they don't want that interpreter, that means she's not going to get to work or she's not going to get her money. That's why they feel more obligated when they have that interpreter in there. Okay, she can stay, it's fine, but inside they're kind of struggling with having that interpreter in the room. And they need that interpreter. It's not that it's an extra, somebody that you don't need. And because over the phone can be a struggle too, and especially with Arabic. Arabic is spoken in 22 countries, and the way it's spoken is completely different. Some words Sudanese people might use, someone from Iraq would not use. And so when you get someone over the phone, it could be another dialect that is not suitable for me and not understandable for me. And a lot of people, I'm one of the people who've lived in a lot of Arabic speaking countries, so I'm able to even pick up from the dialect, like what country you're from. But not a lot of people have experienced that. They've been in their own country speaking their own dialect, the way they speak it. So when someone from Lebanon, I remember I was in court one time, and it was two clients against each other, and they got a Lebanese, they're Sudanese, they got a Lebanese interpreter for the guy, and I was, with the woman, I was a Sudanese, and then she started interpreting for him, and then he kept raising his hand. I want like that one, I don't want this guy, this girl. I don't want this woman, she doesn't speak the same dialect. And it was like, it got disruptive in court. And they were like, okay, can you do both? And that was the thing they had to reside to. And that's about most of the issues that we experienced. Thank you.
So I know we're probably going to move on. But on the topic of like health insurance, one thing that I've recognized in interpreting all of my life, because immigrant kids, they're just interpreters the moment they're here. And it's a great experience once you're an adult because it helps with your communication skills and all that. But I have been interpreting for my parents since I was younger. And one thing that I have recognized is that because of their lack of education around health insurance when they show up to these spaces, so I'll just keep speaking about my mom. So she has thyroid, and obviously that's a very like serious illness, but because she doesn't have a lot of like education on it, she's not as confident. And so when we are meeting with a doctor, she's hesitant because she doesn't feel like she has a right to health care, because if we just think about it, we came from a refugee camp, so we essentially came from obviously no health care at all to health care, and as an adult now I don't have health care. But basically all I'm trying to say is that there's just like a real disconnect of like what people receive, because you're not confident to speak up for yourself could just mean that it could be the end for you. And so education is just very vital in terms of giving people their own right to actually speak up.
I wanted to add to like going to the emergency room versus going to urgent care versus when to go to a primary care, or and people not knowing, like you can call your doctor's office even after hours and ask, especially with children. So they tend to go to emergency rooms, and then they're surprised with these huge bills, and it was just a cold that kid had, and nobody knew about it, that they can only go, you can call the doctor and he would have said, okay, bring her in the morning, she should be fine. And this is something that people need to know, and not a lot of people know this. And when should I go to emergency room? It has to be this, like a big accident or like a heart attack symptoms or something that's huge to me. But not every time that you have to go to emergency rooms. And we had some workshops at our office to tell people, and they were surprised, like, I can call my doctor's office and talk to them after hours? Like, yeah, they can even get the doctor on the phone for you, and that can happen. So a lot of people don't know that.
Thank you. I appreciate the explanation. We've talked a lot about, so it's clearly not the mics. I don't know what it is, so I apologize. We've talked a lot about access to health care, not having it, the importance of education, and making sure that people are educated about their health care and what they can do. Can you guys tell us how somebody would build trust in actually going to see their doctor? Because we have a lot of folks who won't go. Decca talked a lot about pregnant women. I used to work at the City of Portland Family Shelter, and we would have people arrive on our doors 9 months pregnant, and obviously no prenatal care or anything like that, and would just wait until they had contractions. And so I'm just wondering if you guys can talk about how somebody would build trust. And as we're talking and as you're hearing these stories, it's like Decca said, it's not easy for other folks of color, right? It's not easy for the African Americans. So even though we know that we can get insurance through our company, there's some health disparities there. There's still the trust issue and actually going to a doctor. And so I just want to make sure that everybody is aware that these stories are really, really important, and they really talk about access to health care and what we can do to make sure that everybody is healthy. And when we think about that, we have to think about it across the spectrum. So getting back to my question was just how do we build trust? How do we build trust so that people will want to continue to see us? I mean, not us, you.
So I'm going back to the work that I did with the city of Portland as a case manager. I had clients who were HIV positive, and HIV positive and coming from an African country, it's a huge stigma to it. I mean, HIV, even if you have a cancer in our community right now, it's a huge stigma to that. People don't talk about even cancer, let alone HIV. So the way that I build my relationship with my clients is to be open up front and let them know that whatever you say stays with me. I do not share any information that you share with me. So that way, and also the way your body language, I think there is like 80% of the language is coming from your body, for what I understand, is how you are welcoming that person, if you will, and how you're talking to them, and how you are providing the services exactly the way that they are looking for. And if you don't have that service at that time, how you gonna reach out to resources that you have so that this person, client, can get all those resources that he or she needs. So that's how I build my relationship with my clients. And I remember each and every person who has certain, diseases that they don't want to share with other people, they will come to me. And I had clients who did not speak Somali, who were HIV positive, and they will come to me and they will say that I hear from so-and-so that you provided such a good care for them. And they will not even hesitate telling me that they have HIV right away from the get-go. I had clients who were a survivor of torture, survivor of a sexual assault. They will tell me, and they will show me also their wounds of gunshots or electric shocks. So it is how you build that relationship with your clients and patients, which makes a huge difference for them. And they will trust you and open up and tell you exactly what happened to them. That way you can provide the services for them the best way you can. And as Regina know, that we had clients calling us at 8 o'clock at night, 10 o'clock at night, because they really do need something. And the city has a policy that once you finish your work at 4:30, 5 o'clock, that's that, you can. But if Regina is at the, let's say, last time, she was at Hannaford, so one of our clients were there as well who did not speak any English but knew Regina. So they kind of have a sign language talking to each other and trying to figure out, and Regina did not know what the woman was saying, so she called me and said, "Hey, Decca, can you talk to this client of ours? I know she wants something, but she cannot get it here." So she had the WIC checks, and she was looking for milk and eggs, so I had to translate for her through Regina, and then Regina helped her to get those specific WIC products that she was supposed to be getting, because she was grabbing other products and going to the cash register, and they were telling her to go back. This is not the product that WIC covers. So our job was 24 hours, if you will. And as Sana said, we also know these clients in the community, and they're part of our community. So they will ask us while we are in a community event or whatever, that this is happening to me, so how can you help me? Although we are in a wedding, maybe. Like, I'm just here to have fun. Don't ask me a question. But you cannot say that. You have to tend to that person and explain what they need. So trust and relationship is really huge when it comes to the immigrant and refugee communities.
Yeah, I agree with Decca too, and also like understanding where they're coming from. And when you said about a pregnant woman who doesn't go to a doctor, I know yani, my aunts and like my family, you're pregnant, 9 months you're going to the doctor and having that baby. So nobody goes to see care or like just even if they want to see what if it's a boy or girl, they might go in, but not really. Like nobody follows up every month, or no visits, or no vitamins. You try to eat healthy food, but nobody just follows up. And this was maybe a while ago, but like younger generations, it's a lot better where people are following up these rules. And I wanted to say something. I can't just. So this is completely different for them. That's why we need to build this trust, as Decca said, and an understanding of where they're coming from, and the education of everything that they need to go through. And things like when they tell you you are, say, over 35, you're pregnant and you're over 35. They tell you have to do all these tests. We need to check if it has Down syndrome, the baby has Down syndrome. We need to check this, we need to check that. So in our belief as Muslims, if you have a child who's going to be, if the child is growing inside of you and he already passed the 40 days inside of you, you cannot abort that child for any reason, unless it's like a medical risk, something is going to happen to you. But there's no choice of like getting rid of a child, even if it's a sick child or anything that's happening to him. And if there's nothing that they can do while the child is inside my womb, I don't want them testing for Down syndrome. I don't want to know. So most of the people think that way. Like I do not want to know this information. Whatever God gives me, I'm willing to take care of it. But because at a certain, like you cannot, in Islam, after 40 days, that means there is a soul. So if it's the soul, you're killing it. You can't kill your soul unless that pregnancy is very risky or it's killing you. Otherwise, you're not going to get rid of that baby. So that's a big issue for a lot of people who don't understand that point, that we need to do this testing, we need to do that. I went through that experience where my doctor told me that I have to do this test and I have to do that. And I'm like, are you doing a surgery when he's inside? He's like, no. I'm gonna learn anything like new, he goes, no, anything, you'll figure it out when he comes out. And I'm like, okay, then we'll figure it out when he comes out, I'm fine. So it's like, sometimes you have to respect that. And he was really like talking to me, he was like, it's okay, whatever you're comfortable with, we're doing it. So that's what happened, yeah.
And sort of on that topic of trust, I know that as healthcare providers, I think trust is something that should come definitely from the person, and so that's why I agree with everything that they've said. But I also believe in whatever organizations you guys end up in, because I'm sure you're not going to all end up in one place, but really just always thinking about like the leadership that is in that place and how inclusive and how they don't have to be diverse, but how diverse is their thinking. And I know that could be very hard, but basically as immigrants, that is what we need. We need institutional inclusivity. We need to be at the table, and it's just too much of, like, once the nurse comes to my mom, I cannot put the burden on the nurse to treat my mom with care and this and this and that if her institution doesn't uphold all of that. So for me, trust in just people, but also in institutions is very important for the immigrant community, because we're not aware of the systems here. Like we come here and we learn them. And while we're learning them, we're experiencing them just like everybody else. We're sick, we have to have kids, we have to do whatever. But we're also learning through the whole process. And so, I think
I can't, that's such a great point and such an important point, because people want to go to a place that looks like them. So I work for the Westbrook School Department. I'm one of maybe 5 people of color out in Westbrook. There are no teachers of color out in Westbrook. And so I go every day, I walk into my office, and I'm the only one in central office. And so it's extremely important for people, for clients, for your children, anybody to be around people that look like them. And in doing so, when you go to your organizations, one, you have to be an advocate. I know that they teach that in the social work field, and I'm sure they teach that across every field at UNE, but you have to become an advocate for your patient, for your client. That's the number one thing. The other thing is that you have to let your organization know that if you're 99.9% white, there's a problem. And looking at that, you may have to redo your mission statement. You may have to look at who you're hiring. You may have to do different education. You may have to change how that entire organization is seen and how it works. And as you were speaking, I was writing down some notes, and I'm going to give a plug out to Greater Portland Health. I don't know if you know who Greater Portland Health is. They have an office in Portland, and it's over on Park Avenue. And the reason why I'm giving a shout out to Greater Portland Health is because they're walking the walk or talking the talk. See, I don't know why I get into these metaphors, because I just don't remember what they are. I only have half of it, right? So I looked at my friend. What is it? Walk the walk. Did I say it right?
You got it right.
I got it right?
Yeah.
Oh, thank God.
English is becoming your second language.
I'm doing better on my English, huh? And the reason why I say that is because when Greater Portland Health opened, probably about 10 years ago, they knew that they had to have people working at Greater Portland Health that looked like the folks in the community. So when you walk into Greater Portland Health, there's a woman sitting at the desk who speaks French. When you go back into the office, you're going to see a counselor who speaks Somali. You're going to have a variety of folks in that organization that look like you. And so therefore, the trust of that organization automatically decreases. It automatically decreases because they're going to see somebody that looks like them. And so I just really wanted to tell you that that's a really, really important, it's just so important. And so it's about 1:15, and so we could certainly open it up for questions. If folks have any questions that they want to ask. Any questions? It could be any questions. Yeah.
So I know this is cheating because I have the mic already, but I'm going to ask a question. So I'm in the social work program, and I was wondering, aside from advocating in an agency that I work for there to be more people that show diversity, what can I do as a white female who grew up in Maine outside of just that?
Go, girl.
So as I said earlier, diversity and inclusivity, I live in Maine. I do consider myself a Mainer, so I know who's around me, and so I don't expect all organizations to be like Greater Portland Health. But I do also really believe in individual leadership, and what that is just thinking inclusivity all the time. So as you are, you communicate with the leadership, like I said before. So who is the diversity director? And if they don't have one, make sure they create one, because if you have a population that you need to connect with, it should not be okay for you to just continue what you do and go home without actually connecting with them. Because that's basically what I was trying to say all day, is that we have health insurance, through Maine Care and whatnot, but we don't know our rights. So we do need advocates, and we do need people to actually understand where we're coming from. And you don't have to look like me, but you can, just take the time to connect with somebody who can help you connect with another person, or, yeah.
I'm trying to do it.
Yeah.
I think that's a good question. What can you do outside your organization? First of all, I would ask if your organization hires for people of color, if you serve in people of color. For example, I work for the Center for Grieving Children for the intercultural program. So that program has been going for 22 years now. And we had only people of color staff for the past 2 years. That doesn't mean the folks who've been running the program were bad people or whatever, but they had to work for what they had, or maybe it was not in their lens to have folks who look like the kids that they serve and to be the staff as well. But you know, we come in a long way, and we also live in Maine, which is I think the widest state in the country. Maybe they're debating between New Hampshire and Vermont, but we are there, the top three, if you will. And I think it's very important to have people of color, minorities, to be able to serve those who are you serving, right? And the staff should be reflection of the clients as well. We don't have that a lot here. But we also have a lot of people who are coming from other countries who are doctors, who are nurses, who are engineering, but they have that barrier for the language. But they do have the qualifications of becoming an engineer, nursing, and I can tell you one of my co-workers now is going to be a nurse practitioner. She's from South Sudan. I'm so excited. I don't know why. I said, I'm going to be your first client or first patient. That is how important it is. My doctor was from Philippines, and I was really, really happy to have her. And when she left, I was really angry. So I didn't have a doctor for a year, but I had to have a doctor. But anyway, that's another story. So it is extremely important to do that. And what can you do outside from your organization is that to have advocacy, to change the system. We have a system that is really so locked on old ideas and all idealistic things. But we have a lot of young people coming out who saying that, and white young people saying that this system does not work for all. And I want you to be that system changer who's saying that I want to see more people of color, more people of in the LGBT community. You know, that's another community that's been oppressed for a long time, and we don't see them in a higher positions for them to work on. So if you are serving a child who is a transgender and you are a straight white person or a straight black person, how can you serve that child? There's no way you can do that. So it's extremely important. And when we say diversity, sometimes we just think black or white. It can be old, it can be young, it can be people who are disabled. So let's just also think about that as well.
I just want to add, she talked about Greater Portland Health. At our office, we have a peer support group, and our office is, even the people who work there, there's 2 Somali speakers, 2 French speakers, and 2 Arabic speakers, so it's kind of diverse. And Molly McMahon, from the social worker from Greater Portland Health, comes in and works with the peer support group, which mostly French speakers and Portuguese speakers, and she volunteers her lunch hour every Tuesday to come in and talk to people. And she has built a lot of trust with the community that I've heard some of the Arabic speaking people too calling her my oldest sister. Molly is my sister. So that's the kind of, she stepped out of her working place and went to an organization like ours and was able to serve the people in the community, and so they know her personally now. A lot of people know her through that.
Any other questions?
So thank you guys for being here, sharing your experience with us. My name is Rico, I'm a Poland resident, first generation immigrant. So my question is, first and foremost, empowering immigrant women. Thank you very much. My question is, I know we're here to talk about mental health issues in the hospitals and the challenges immigrant families face. However, that's not the only issues we face. We face that same issue in the school system, specifically for our minority immigrant kids. Sorry, can you guys hear me? Especially around our immigrant and minority kids. Now, my question is this. Provided the language barrier and provided that professionals hypothetically should be trauma-informed, how do you, as a person of immigrant background, a person of color, use your experience to kind of highlight the challenges kids go through? They go through a lot of traumatic experience because they have nobody speak for them. And the individuals that are in these roles that supposedly supposed to speak for them are traumatizing them. So my question is, there is a barrier, there's a clear barrier, but how do you leverage the immigrant's first experience as the first narrative, not the second narrative, and seeing students as teachers? Because the best teacher is a student. Teachers are not necessarily teachers. Teachers should be students. So how do you empower students? Because I went to Reiki School, I went to Poland High School, I went to King Middle School, all great education, but not great teachers because there's a lot of love for this school system that I have, and I am hoping that there's more clarity I could provide with my experience to the individuals that I go into school with and help them understand what system they're really in and where their position in that system is. Sorry, I do talk a lot. Hopefully that was a clear enough question.
I'll try to answer that. I think from my experience, you just have to allow the young people or the people that you are working with, interpreting, doing service for, to be like where they're at, because we are all at a different place every day, every hour, every minute, probably. But to be the interpreter or the coordinator and assume that that child or that parent's experience, that I know it, is not okay. And in my experience, I think silence has been really helpful in terms of just listening and just like being has been helpful. And then just sharing your own personal stories and your own struggles and just connecting, because when somebody's new, when they're new to a country, what they need is connection. Like the number one thing they need is connection so that they can feel comfortable. So whatever that connection is in the healthcare world, whether it be the doctor going to sit with people of diverse backgrounds, that's a connection. Whether it's that or something else, I think that helps.
So mental health, again, is a huge stigma in the immigrant community. It's big. So in my second year grad school here at UNE, my internship was at Lyman Moore Middle School, where we have a large group of kids who are immigrant background. So I've seen how the teachers, and please don't get me wrong, the teachers are really good people. But again, they stick to that system that they have to follow, right? So I see a lot of children that are being banished, if you will, differently than their white peers. And kids will take that to heart and say, my teacher is a racist. He would not let me go. And I hear this from my daughter too. He would not let me go to the bathroom, but he did let go the white student to the bathroom. So I created 3 different groups at Lyman Moore. We had Muslim girls, we had other girls, all girls, and gentlemen boys. We're all kids of color, and they really talked about how they feeling in the school. They're not welcomed, they're not happy with what the teachers are doing, the teachers are always blaming them, and that will really make their mental health really, really not well, right? And you talk about trauma-informed. We, as Regina said, we talk the talk always. We rarely walk the walk when we are trying to provide services to these children. So I took that with me really heavily and put that back to my Somali community. And what I have been hearing from my Somali community girls was that their parents don't allow them to go for a sleepover. Because we believe in that. If you go to this white family's house and we hear all of this sexual, molestation or whatever, we have that in our, in our minds. Talk about single stories about the video. I don't know if you guys saw that video for that danger of single stories. So we had that single story stuck in our minds. If my child goes to this white people's house, they will be molested. So we don't let our children go out for, especially for girls, to sleep over. So the girls in our community were talking about that. They were born here. They're Americans. They want to have that experience. I want to sleep over my friend's house, but my mom is not allowing me to do it. So in our community, we said, what can we do? So we created a girls' retreat where we connected with Friends. It's a Quaker organization. Their house, it's right across the street from Riverton Park, and they gave us that house every school vacation. So we go and have girls from 3rd grade to high school. And all of those girls have also college girls from Somalia as well to do volunteering for them. And also the mothers, like me, being the adults to facilitate the meetings these children are having and these students. And also other mothers and fathers bringing the sleep mattresses or sleeping bags and things like that, and cooking as well. So the kids have a space now that they can talk about how they're feeling, what their mental health is. I was really shocked to hear a child who was a 5th grade at the time, I think that was last year. She was talking about how she was bullied in kindergarten. I mean, she kept that with her all these years, and she cried, and you can see that the high school girls were crying with her, hugging her, telling her that she's good, she's doing well, and the girls are looking forward to that retreat every single school vacation week. And our numbers are getting bigger and bigger and bigger. We might need a bigger house now because we cannot fit them all in for the Quaker house that in Forest Avenue. So it's a huge thing to talk about. And also, I'm going to go back also the fact that we need people who look like, again, these kids when it comes to social workers, when it comes to guidance counselors, when it comes to teachers. And Portland Public Schools are really struggling with that. They are really struggling with hiring people of color to serve people of our children who are from in different countries in the world. So that is where we need to make the change. Hire more folks who are really can do it. Newell is one of the youngest people that I know who can do anything, if you ask me. You as well, And I was happy somebody said that they were being a teacher in Facebook, and I was like so happy. A young girl who just graduated from Howell, and you too, I think, right? You're thinking about it. And I really forced my son, who is a 2nd year at USM, to be a teacher. He will be an absolutely great teacher. He loves kids and all of that good stuff. So we need, again, people who look like the children that we are serving, if we want to talk about in their mental health wellness.
I just want to add groups like Empower in Portland schools, and there's one Westbrook in Westbrook, I think, Regina. One Westbrook, she leads that one. It's more, these groups are there to encourage parents to get involved with their kids and to go to conferences and to speak up if they think that their child is having issues at the school. So a lot of parents feel like, if I'm going to need an interpreter, I'm not going, or if I can't voice out, I can't tell them what's happening, I can't go to that school, or I don't want to get involved or something. So these kind of groups kind of encourage the parents to get involved with what's happening to their kids at the schools, and that's really important to have these groups.
Hi, we're just checking to see if there's a question from the Biddeford campus. Okay. No? So now we want to get, if there are no other questions, we're going to talk a little bit about, oh, there are a couple questions, sorry.
Sorry, I had a question, but I was waiting to see if students would ask. But my name is Nanta Maun, and I am with the public health program here. And I just want to hear your thoughts on, sort of given today's topic and with my own experience working with immigrant communities, what I find interesting is the family dynamics and the role of men versus women, and their responsibilities and expectations for their family's health. So just really want to hear your thoughts on if there are any specific challenges that are specific to women, and if there are strategies that we all should be using to help women, to help empower women.
Again, I'll speak from my perspective. In my family's experience, in observing my parents, well, my father just passed away, but when my father was alive, he lived in Maine with us for a really long time, and what I observed is that he was very hesitant on like going to the hospital, opposed to my mom. So my mom had 2 kids here in Maine, and so because obviously she was pregnant, she was going to the hospital a lot, and she's still going to the hospital, but because of that, she feels more connected and more comfortable, I would say, with hospital personnel. Whereas my dad, and I can probably attest this to other people in my community, was hesitant because he had a really negative experience with the criminal system here in the U.S. And so with that experience that he had, he lost trust of pretty much the whole system. Just in observing that in our family dynamic, I think like men in my community are hesitant, and that has to do with how Black men are treated in this country. So if I'm like scared of the cops because they don't, whatever, then I might feel uncomfortable with somebody who looks like the cop. So that's the unfortunate difference that I see in my community.
That is a very difficult topic because there is actually cultures within the cultures. So people might say like Muslim women are all like men who rule everything, they rule the house. It's different from every community. It's different sometimes from a city to the other one. I know there's some Iraqi families where the woman cannot do anything unless the husband says so. And on the other hand, there's some women who actually are considered like the head of the household for when you look at it. So it's hard to make a judgment that everybody's like that, and so you need to keep an open mind, not to think that every woman that comes in should talk to her husband, or like her husband is the one who is making the decisions. I've heard from women who would say like, my tooth hurts, but my husband said, no, don't take it out. It's gonna make you look bad or something. And I'm like, I even told her, I'm like, forget about him, just go, if you need to treat that, just go do something to it. So it's just, I think some women just need some encouragement. It's not something that they're refusing to change. They try to adapt to the country too. Some of the people try to adapt to it. So it changes within time for most of the people, but it is something really difficult. And I understand, because a lot of families, that it's very hard for them to be able to get from that umbrella of a man controlling the house, and that's really difficult. But just you need to keep an open mind and understand that no matter whatever you have, whoever you have in front of you, that's not the idea that's not their family dynamic. It's not everybody that's like that. So that's that. If you ask my husband, he's going to tell you that too.
Yeah, no, I totally agree. I wasn't implying that. I think it's just that there is maybe that sort of prejudice or understanding, and it's, from my experience working with, it's actually the women that are the facilitators and, that are really working with kids. So, realizing that and helping them sort of, I feel like women, they feel the responsibility to actually take on health for the whole family. So knowing that, how do we empower that?
Yeah,
was
yeah,
more my
you're
question.
right. I mean, it is, I'm just saying that it's different, but it is happening. There is like a lot of people who are more controlling. Like you see the husband is more controlling in the house, and he's the one who's making the rules and everything. But still, like a lot of women are learning to have more experience and try to get out and learn more. And so that's educating them, and that's helping them a lot.
Yeah, I agree. A lot of notion is that, and you're not saying that, but it's all over. You know, Muslim people, Muslim women are really not doing anything. They are being oppressed. They are all of these, things that are out there. But that's not true. I grew up in a house that my dad said, I'm the highest person in the household. My father was very well educated. Again, also it depends on the education of the parent that you are growing up with. So I grew up in a place that I was the head of the household right away. I have the key to the safe. I can give money to whoever, and I was very young. And my father and my mother will talk about certain things to me, and I think I find out that I'm a social worker 10 years old. I will not, I will keep things away from others, and they will find out from each other. I told her, yeah, but she didn't tell me. So I'm like, why do I have to tell you that? He told me, he didn't say you can tell her. So when I came to this country, but the funny thing was that my husband grew up in the country. He did not grow up in the city. So he kind of tried to kind of be the guy or the macho man. I'm like, oh, no, sir. You're not. And I did not drive at the time. I was new to the country, and he's the one who brought me to the city, so he wanted to maybe put me in leash. That's what I call him. You're trying to put me on a leash here? Dude, I'm leaving. Bye. So he realized that from the get-go right away. And he's a good man, don't get me wrong. He's a really nice guy. But men will try anyway, especially when you are coming from a culture that rules. Men are, everything, and women are nothing, right? Second, citizen or whatever. So from the get-go, I said, But I also seen some community members, Somali women in my community, that are following whatever the husband says. So how do I make sure I tell this woman, empower her, that she can do things without her husband, but also keep the family together and do not break this family, right? So I empowered the woman by telling her, this is what you can do. If you needed to drive a car, there is a certain places that will have you, pay you whatever. So we find those resources for them. So by the time they get to understand the system and they taking the children to the doctor and doing this, the husband will say, oh, she's doing all the work, thank God. Let her do it. So then, everything becomes easy for him and her, and all of that cultural barriers that has been happening is kind of dissolving and getting out of the way. So the Somali has been here for a while, and also the Southern Sudanese community for almost 22 years in Portland, Maine. So they learn from the hard way, and you can see the vignette will tell you how things changed from 20 years ago to now. But a lot of new communities are coming in here, like the Rwandese, Burundese, Congolese, and the Angolan communities who are really having a hard time, being part of the system. And we are still bringing our children, we are spanking our kids, if you will. And they don't understand the fact that if you hurt your child, DHS will be really taken from the kids from you. One of the things that I always remember is I had my children in Atlanta, Georgia, where you don't see nothing. You work and that's that. No handouts, no nothing. But here, when I first came here, I went to one of the Somali stores in Lewiston, and this elderly man was talking how the community is holding the children by the arms, and the government is holding the children by the legs. And whoever is strong will get the kids. So I'm like, what does that mean? They said, there is this department called DHS. They take the kids. So you have to fight them all the time. I'm like, whoa, I did not know that back in 2004 when I moved here. But as I work with Regina at the city of Portland, we've seen a lot of things like that happening.
I love the piece in the beginning about how there was a new provider who went around and went into these communities and went to the grocery stores. So what are some of your suggestions as new providers as we get out there, and especially in Portland where it is so diverse, and you said so many more communities are coming in? What do you think are the best ways for us as providers to get involved in those communities, or to just make ourselves known so that we can work on building that trust with these communities?
I think working with organizations or agencies that deal with immigrants and refugees, our organization is a nonprofit organization. We've been here since 2014, and it's fairly small, but we would welcome having providers in. We do workshops at our office where they're interpreted to English, French, French, Somali, and Arabic at the same time. So we have the providers come in and talk to us. Even if you come in and volunteer a workshop, and we would invite people to come, and you would get questions, you get more involved and get more, have this connection between you and the community that lives here. That's a big issue too. And working for places like Greater Portland Health, she was talking about it, where it's a lot of diversity within the clients, within the employees, and that should help a lot.
And just one really quick place, I know in Riverton, so Riverton Park is one of the housing neighborhoods that Portland Housing has, and they have a health facility in their community. That to me is very unique, and I think one good place to start would be maybe to volunteer there, just because they live there and the people are there, and you can connect with the program directors there.
Yeah, they are part of Greater Portland Health. Yeah, the clinic that's in there is part of Greater Portland Health, so that's.
Yeah, but if you go into their neighborhood, it's good. Yeah.
Do you have something to say, Dr. Fennell? I really and truly think that if, for the folks that are living here in Maine, and maybe even if you're leaving Maine, your work starts now. Your work has to start now. So I'll give you an example. In Portland, I'm from Maine, and when I was growing up, you knew the black person walking down the street, right? If some new person was walking down the street, when I was younger, literally the world stopped. And then there would be a bunch of phone calls all through the neighborhood. Who the heck is that? Right? And so nowadays, Portland is 85% white and 15% of color. Westbrook is 91% white and 8% of color. And so you have to know your communities. I'm not saying you have to do all of your research, but what I'm saying is before you go out into that big wide world and before you get your jobs, do a little bit of tiny research on who the communities are that are out there. I talk about Greater Portland Health because not only do they have folks that look like the community working there, but they also have, Molly McMahon is a wonderful person. She is the director of their social work program. She knows the words of certain languages. So she's gone beyond, right? So, and believe you me, I've tried to learn Arabic and it just doesn't work. But what it says to her clients is that I've done some research, I've listened to you, and so before you graduate, do some more, find out what the communities are that you're working in, what are the races, what are the communities like. You would do that if you were going to go and apply for a job. You're going to do the research and look. If you applied at the Westbrook School Department before you go for a job interview, right? You're going to Google that. You're going to Google Westbrook School Department and say, okay, so what is this about or what is that about? Do the same thing for these communities. That's what the website is all about. And then I think that some of it will come if you get a job within these within organization, or even before when you go for an interview, ask them, what's the percentage of your population of color here at this organization? What do you do to serve all? How do you provide equity? Ask them those questions and see what they have to say. And then when you get into it, like all of these wonderful women have said, advocate for different policies or advocate for a different mission. Get to know your clients. One of the things that I always say is that I certainly understand that there's, Decker talked about it a little bit earlier. I certainly understand that there's a checklist that you have to go through when somebody comes into your office, right? The doctor just goes through the checklist, you know, hide your blood pressure, all that other stuff. I take an approach that's a little bit different. Listen to the stories of your clients. You will get the same information that you want by listening to their stories and asking questions, as opposed to just going through a form and filling it out. Because that is the relationship that you're going to have with your client. The client's all of a sudden is going to be like, wait a minute, you care about my story? You want to know where I came from? And that's going to go a long way. So there's several things you can do. As an individual, you know, for me, even as an African-American woman, when I ran the Refugee Services Program, I wasn't about to just walk into somebody's house, you know, somebody from Somalia or Sudan. I couldn't do that because there was still that trust issue between an African-American woman from the United States in Maine and somebody who was from South Sudan or somebody who was from Somalia. I was lucky. I was able to bring my staff with me. So the trust level was able to be diminished a little bit. And so it's going to take time. The other thing is that there are umpteen thousand events that are happening in Portland. I just went to, last Saturday, Decker and I went to the Equality Main dinner. First time I had attended. Amazing, amazing program. It was fabulous. It was absolutely fabulous. I think it was 720 people that were at the Holiday Inn, and it was a great event. And so know your events. Go to some of the events. There's still white people that are going to these events. So it's not that you have to be uncomfortable walking in the door. So is there any other questions? Okay, so I may have messed up because I don't think we have time for the vignette. And so I really apologize because it's like, is it like 120, 125? Yeah. So I'm sorry. I wish we had time for it. But I am going to put in a plug. There is a town hall event on next Thursday on April 18th at 6 p.m. And what I'll do is I will save this vignette because we also have another one. I will save this vignette for that time. And I really apologize. Again, when we began this panel and we began this discussion, for us, it's more important to have the connection with you as opposed to anything else. And so we appreciate you allowing us to come. We appreciate your questions. We appreciate you listening. And we hope you have a great day.
Thanks to all of you for taking the time to be with us.